This is an introduction to how to complete induction of labour on Lorenzo instead of using the induction of labour booklets that we currently use. You'll recognise the screen as this is the main screen once you open up the Lorenzo application. From the left-hand pane, we're going to select Inpatient. This will ensure the patient you're using is admitted. You can see I'm selecting my ward, and it's the antenatal postnatal ward. I can minimise this task pane. This is a test environment, so it does look slightly different, and my patients are at the bottom. So we've got quite a few test patients here. And I'm going to use this lady here. So I'll select, and I will view the patient's EPR. If your patient isn't on the pegboard, you will need to admit. You can see this gives all the patient's general details, and on the right hand side you need to go to maternity. So this has opened up the patient's EPR. She's got minimal details on here. She's got a fetal record and current pregnancy record. Firstly, we're going to select antenatal review. And this needs to be completed, all the fields. Have you done a urine specimen? If you select yes, it asks you if there's any abnormalities. We're going to put no. Have you sent a midstream urine? This isn't applicable. Has she got any other disorders of pregnancy and your overall assessment? You can then click next. This is your overall assessment of the abdomen. Abdominal findings normal, yes. If you click no, you can go on and explain further. Has she got any contractions? Has she got any PV loss? And what activities have we carried out? So we've generally given advice. We might do CTG monitoring, and we're going to do a vaginal examination. Click next. Every time I click next, you can see here it moves along roadmap steps. So we're now on maternal well-being. Has she any mental health that you're worried about? And next we're on to fetal details. Filling relevant. If there is 2 babies, it will show fetus 2 there, and the fetal number will be 1 of 2 or 2 of 2. So fill this in with the relevant details. And then you click add. This puts this into the bottom. Fetal movements. Have you got any concerns? Has she felt movement today? And was it by the patient? Have you felt movement? Again, add, and then finish. This really is your baseline assessment, the front sheet of the pathway. So we've now got an antenatal review here. The next step from the left-hand side is vaginal examination. The date and time of assessment, this can be altered. If you've done it earlier on in the day and you're now sat doing your work, you can change this date and time. So it may have been 09:30. If you put a tick in the box, it defaults to the card that's in there, or you can search for your colleague's name. Have you had a chaperone for BE? If you're with a doctor, then put in what's happened, but I tend to put not offered, midwife completed. It's a digital exam. The primary reason we're assessing for induction. Any additional reasons? description of membranes. You can see now you've got a green tick where there was a red exclamation mark, and there's 3 pages to this. So we select page 2. External genitalia abnormalities. No. Is there any FGM? The cervical position. Consistency. Effacement. It is in a percentage, unfortunately. Your dilatation and your station of presenting part. Unfortunately, this doesn't automatically add up your Bishop score, but we can see from ours, she's anterior, she's medium, 0 to 30, so she gets a score of 3. Presenting part, cephalic, just work your way through this as you would. Then on to page 3. Is there any PV loss? Have you taken any swabs? And have you heard the fetal heart? You can now finish at this point. If you have missed any mandatory fields, it won't let you continue. This is your print page, but we can cancel out of this. Now we're going to complete the prostaglandin and the oxytocin, which again you select from your left-hand side. It's just there. Now this is the important part. The stage administered is the antenatal. It will automatically default to induction of labour, and then we're going to select the primary reason. There's quite a few to choose from here. Is she post-dates? Is she pre-labour rupture of membranes at term? Pre-term rupture of membranes? Is there any other secondary reason? Plan of care. Comments here, I want you to put in Propess 10 milligrams or Prostin 3 milligrams, whichever is appropriate. We're using prostaglandin. It will be given vaginally. And when have you given it? If you select today's date, it will default to the date and time. However, again, this can be altered to reflect true timings. We're then going to add this. Click Finish. Click Cancel. This is just reminding you what still needs to be filled in, but we can click Cancel here. All other information I want you to record on a history sheet and also complete a CTG sticker and the Muse chart. And that is the basic induction process.